Welcome to the Cerner Power Chart overview of the menu. In this video, we're going to take an in-depth look of all the different menu sections that are on the nursing and student nurse position. As you can see, our menu is quite long. In our previous video of starting your day, we highlighted different areas to prioritize to review and find information about your patient. Those areas are your nursing workflow with your admission workflow and documentation, orders, which display your medical plan of care for your patients, EMAR, which will display previously given medications and medications that are due, and the ClinPick, which provides an overall view of your patient with information pulling from different areas. So we're going to go ahead and start basically from top to bottom and work our way down with each of these menu tabs. Some of these are duplicative and you can find this information in other places. As you can see, my filter status is selected to all. I can move it to active and only see those that are active, or I can switch it back to all. From here, I can highlight an allergy and modify it. I can also add allergies as well. Problem and diagnoses are mainly used by our nurses and physicians. Nurses review problems, which is past medical history, and update those upon admission. Physicians will put in different diagnoses based on why the patient's here for this visit. Problems will follow the patient from visit to visit and should be reviewed with each admission. The flow sheet is primarily where nurses document. There is a separate video to review specific areas of flow sheet documentation and how to do that. Our task list includes different tasks for patient care. Tasks are generated by order. So if there is a scheduled patient care, PRN tasks, nurse collect order, these will populate here as well. The I&O page will display any intake and output results. It looks like we do not have any recent intake and output results for the last 8 hours on this patient, so it is blank. The blood product summary is very helpful in that it will provide an overview for any patient that has had an ABORH to identify their blood type and antibodies, or has any pending or previous blood product transfusions. Current meds will display the current meds that the patient is on. These will be divided into inpatient meds and home medication. This is printable and can be used if you need to give report or keep track of your medications. The MAR summary is typically used by the providers to review when meds were given and which ones have been charted against. The medication list, again, just displays orders for medications. Our form browser is basically our repository of all the Power Forms that we have. Some nursing documentation is done in Power Forms. Other care providers, such as pharmacists or social services, also complete Power Forms. From here, you can review the date and time that they were done. You can see the history of them, and you can add to them by modifying if needed. Reports and documents is where you will find all documents related to the patient that have been entered electronically or scanned in by our HIM department. There are different categories. As I'm looking under clinical documents, I can find an H&P that is completed. You can pull and make these columns customizable so you can see the date and the provider that completed this. If you want to review progress notes here, and then any type of surgeries, you can just keep opening these folders and double clicking to find the details of that document. Reports and documents can be organized in different ways: by type, by status, by date, by encounter. The default is by type. Patient information will display the patient's demographics, including their address, and general registration information. To view to see if they've had previous visits, you can go to this visit list and it will display all visits that they've had at Memorial. You can also review their face sheet, which basically displays the patient's insurance, their emergency contact, next of kin, just some basic information from the registration documentation. Advanced care planning is where our social services, our ethicists, and pastoral care document. Advanced care directive information is located here. Additional details from what the nurses document on admission are elaborated on by our social services group that helps manage this. Any pastoral care documentation will be seen here as well. The patient schedule. If the patient is scheduled to go to any type of procedural or radiology procedure in Cerner, it will be displayed here. As this page is blank, this patient is not scheduled to go anywhere for a radiology imaging study or a procedure. Results review lets you review different things in the chart. There are different tabs up here. If they have any ECG stress results can be here. Lab results and radiology results are the main tabs that you'll use to review different results. Clinical assessment and last 2 days will include a summary of flow sheet documentation that most nursing staff look in the flow sheet. The gray bar listed on the page, you can usually right click and change the search criteria. From here you can display results by count. The max number of results to display is 999, or clinical display, which is the range, which is a date range. From here you can select and update the range of results that you're looking at. As you scroll through, you'll see different things that have been resulted. If you scroll backwards, you can find results that were previously done. Just be sure to look at your date and time to make sure you're looking at the recent results and not old results. If there are no results found under a section, it will display no results found. And again, if there is anything that has been canceled or has been an error, it will display that as well. Microbiology reviewer will let you see any labs, pathology results. If you have any results, they will display here. Same with the microvirology results. We have a blood culture and different notes on how that culture grew. The advanced graphing is not a section that is used by nursing very often. Progress to discharge is primarily used by our social services and care transition team. Our CareDex helps reorganize our orders into different categories and is an alternative display to the order screen. It will break the orders down into more specific categories, such as precaution prevention orders, specific vital sign orders, notify provider orders. It's a little more detailed than what the order summary page displays. If you're someone who likes to kind of have things broken down into smaller pieces, this is a great place to look at your active orders. The anesthesia summary will display anesthesia records. This is primarily used by our CRNAs. Our signed anesthesia records will be displayed under the ClinPic under the last 50 documents. If the patient has any images, it will be located under Multimedia Manager. And if there are any images found under this patient, you'll be able to double click and view those. And the last section that nursing has are histories. This is documented upon admission and carries from admission to admission, so nursing does not have to start from scratch when documenting this information. To review, you can right-click and view to see different changes and modifications made to it. To update or change things, you can double-click in and make any adjustments that are needed. For procedure and implants, this is a histories piece, so if they have any procedure history that needs added, you can select the Add button, and the same thing with our implants. So as you can see, we have quite a few different menu selections. In addition to the workflow, orders, EMR, and ClinPic, reports and documents will let you find basically any document that has been signed in the patient's chart, and CareDex offers an ability to break down orders in more finer categories, so you can review orders that are active in a little more specific way. So this concludes our menu review video.